Welcome to Designer Smiles. I'm Dr. Ann. I'm excited to show you our new facility, so come on and let's take a look. Some people have asked me what makes Designer Smiles different. It's very different from the moment you walk in the door. My main goal with this facility was for everything to be open so that you can see everything that's going on, from our homey waiting room to our open reception area. We want every one of our patients to feel like part of the Designer Smiles family. As you can see, I'm in probably one of your least favorite dental positions. Our goal here is to make this as painless and comfortable as possible. So I'm going to make it easy for you. Come in, check out our ultra-modern facility, meet our team. We'll do a full exam, take a look at your teeth, let you know if there's anything that needs to be done, if it needs to be done, what it's going to cost, all complimentary to you. I'm Dr. Ann Haggard. I'd like to personally invite you to come to Designer Smiles and see what we're all about. You don't have to take my word for it. We've got a few patient testimonials to kind of describe the experience that they've had here, and I look forward to meeting you.
I came to Dr. Ann because I'd had terrible experiences with going to the dentist, and actually I hadn't even gone to the dentist for about 20 years. And it shocked me when I started thinking about how long it had been since I'd gone to the dentist. But the last time I went to the dentist was when my children were young, and I was having a crown on a tooth, and the dentist called his whole staff in and said, "Look at this." Of course, my mouth was wide open, and I wondered what they were looking at, and then it dawned on me they were looking at the top of my mouth. And I have what's called a tori, and how did I know that everybody's mouth wasn't shaped the way mine was? Because I'd never looked at anybody's mouth. And it actually brings tears to me to really think about that experience. And, you know, they were talking about they had never seen one like mine. And I thought, oh my goodness, what is wrong with my mouth? And they were all standing around laughing. And so I just quit going to the dentist. And I took very good care of my children's teeth. I just didn't take good care of mine. And so one day I just decided, I am really getting older. I'm going to have bad health if I don't do something about my teeth. And I started looking for a dentist. And my husband, whom I had married 6 years ago, wanted me to go to his dentist. But he was a retired Air Force dentist, and I thought, I'm not going to that. There's no way. So it took me about a year. I had seen Dr. Ann's story in a magazine, one of the Bay Area magazines, and then I had just seen her 3 or 4 times. I would pick up a magazine or something and see her picture. And so I went online and I started researching. And I thought, I think this is where I will go. And one day I just got my nerve up and called, and this person named Angel answered the phone. And I thought, oh my goodness, you know, what a nice thing, you know. And then we talked, and when we hung up, I said, well, you really do live up to your name. And I just screwed up all my courage and came, and that was October a year ago. And we're almost through with the procedures in my mouth. And Dr. Ann said, what do you want? And I said, I want a healthy mouth and I want a nice smile. And so she's giving me that. This is absolutely where I need to be. And when I came in, everybody in this whole office, you would have thought I had known them forever. They just treat you like you're their best friend. You feel like you belong.
Okay. Well, the reason I come to Dr. Haggard and her staff here at Designer Smiles is because, you know, the quality of dental care that I get. There are a lot of folks in Houston who are very good dentists, but I come to Ann because I think she's one of the best in town. I've had Invisalign done. I had some adult onset crowding, which is really, as you get older, your teeth shift forward. And having braces as a kid, had my braces taken off, I'm even at a larger risk of having the crowding to begin. And Ann suggested Invisalign, and it definitely improved my smile, straightened it back out, and got it to where I want it. So being in the dental business, that's very important. Your smile is definitely your calling card in this business. I said, one, she's clinically sound and excellent. She's a very good clinician, and dentist, and very professional. You know, everybody now these days looks at their own health, and you can investigate certain things, and you read things online. You may be familiar with like systemic links between periodontal disease and heart attacks. There is some definite science behind that, and one thing they do check here is for that. And so I know that she's always up on the latest and greatest techniques and is always wanting to stay on top of her profession, like any good dentist should. If you came to Designer Smiles and saw Dr. Ann and the rest of her staff, you would be very pleased with the level of service that you got, both from the front staff to the dentist. They do an excellent job.
I'm an optometrist, and in my practice, I'd like to explain to patients what's going to happen to them so that they understand what I'm doing and they can feel comfortable with it. And I see the same thing here with Dr. Marcus Haggard. He explains everything to me as he's going through my examination and my procedures, letting me know what's going to happen, what I'm going to feel, should this hurt or not hurt. Those kind of things work really well. And Dr. Ann does the same thing, explaining to me what a problem might be or might not be and how we're going to address it. So we feel real comfortable with that. Well, for somebody who's put off seeing a dentist for years and years, it would be a good idea to come in, get an evaluation, find out what needs to be done. And that's what they did with me. Found out what I needed to do, and then we made a game plan. All right, we have to take care of these things in this priority. Take care of these first, take care of that second. These things can wait. What do we need to do to get you to where you want to be? So that really worked well for me.
I don't know. Well, how I met Anne, I'm a massage therapist, and her family would come to see me as massage therapist, and then she said, "You need to come and let me work on you." And I came over here and got a cleaning first, and I said, "Oh my God, my mouth has never felt that clean before." And so that's where it started, the relationship with the dentist, coming in this office, and it just has grown from there. The staff here is wonderful. You come in and you're greeted, and they look after you, and the care you get here is just it's amazing. The hygienists, they do a wonderful job. The staff, they take care of you, they look after you, they check up on you, and they seem to be very knowledgeable about what they're doing. They're always on top of stuff here. I enjoyed coming here. My whole family comes here. I had a bridge, but besides Invisalign, I had a bridge. I had a bridge before, and redid my bridge for me, and now the work was so well done. I have to show people my bridge because it's not obvious anymore. It's amazing. It's one of those porcelain back bridge, so there's no. It looks natural. It looks real, like normal teeth. So it's not very obvious, and when I like that I really like.
Well, I've been a patient with Dr. Ann probably 3.5 years. And she came through a referral. I met her through a business function, and then some of my friends were using her. And so, well, that's good enough for me. And so, she wanted to get it done much quicker. And so, but she was patient with me and did a very good job. And like I said, I'm very pleased with all the results. It took a while, and I had to go get it done, and I'm now complete, and I'm very, very pleased with the work. Had a lot of compliments. And I had gangly teeth. Like that. I mean, and she really, and first of all, your mouth is your health. And I'm a firm believer in that. And so I've really gotten into that. So I said, I got to pick a really good dentist because I've had other ones in the area. And I like about her because she's up to date with all the latest and latest of everything. And she'll go continually and have I'm going to say, refresher courses, and I'm probably not doing it just for her profession, but she's on top of the latest and greatest of what's going on out there. And so, yeah, I'm very pleased with her all the way around. Some of the best staff. They're like friends. You come in, hey Tom, how you doing? And they sit you down, and you always have a nice conversation. It's yeah, it's a business, but it's more like family. It really is. It's never too late. look at me. I'm 62 and I'm loving it, and I get compliments every day. I've got to make up for the overweightness and the loss of hair, so at least I've got a very pretty smile. Compliments to Dr. Ann.
I came here when I was brought my wife to a clinic, and I was walking around and I came to Dr. Haggard, and she was very nice. She walked out to see me if she could help me, and I said, no, not really at the present time. I'm thinking about having my teeth repaired. And it went on for about a year before I came back, and then I had decided to do something about my teeth, which were stained and chipped. And really, I was uncomfortable even smiling. Forgot how to smile. And once I came here and we proceeded with the tooth repairs, the veneers, it wasn't like I listened to the television advertisements of other dental work come in and we have you ready in 1 or 2 days and such. And then when Dr. Haggard told me that it takes so many months to get it done, but because of the healing process, I was impressed. I said, I can't do that much work on my teeth and do it overnight. So I waited, and after the preliminary surgery, if you could call it, she made me temporary teeth, which look very nice, and I was able to go on my trip on a cruise with my wife. And after the healing process, came back and have the veneers done, and again I learned how to smile and look at people in the face. From before, I was somewhat embarrassed doing it. And I can chew now. Anything I want to chew. I can eat in comfort. Probably just as comfort and no pain as when I had my original teeth and when I was young.
When I was looking for options to help correct some of my vampire teeth and some of my smaller teeth that weren't quite fully developed, Dr. Ann Haggard suggested we do veneers on my teeth. And at first I was like, well, how long do those last? Am I going to have problems with them staining? And she assured me that they're lifetime appliances. There's no problems with them, and I can pretty much eat whatever I want. Obviously, some things will still stain like normal teeth stain, but there's nothing in addition, which was nice. The process was pretty easy. They just, obviously my fangs had to be sawed down a little bit or cut down to make room to put the veneers on. But the process was done in one day, and I was left with a perfect smile. It was great. The feedback that I've received it's a very subtle change, is why I liked. People look at you, they know something's different, but they couldn't quite tell what it was. So that was nice, because it wasn't like an overwhelming, oh, look at me, I have these bright white teeth now, and nothing fake or false about it. It looked like a natural smile. And it's nice to look into a mirror now and just see a very beautiful smile staring back at me. I've had actually a lot of people come and ask me about my experiences with designer smiles, and I am 100% always saying, please go see these people. They are wonderful here. They'll treat you right. It's ridiculous.
I actually was referred to Designer Smiles from a close friend. I was seeing another dentist and had extensive dental work that I was in the process of having done, and had really poor experiences. And you don't think about how important it is to have a good dentist, because it's kind of like you get your teeth cleaned, oh, you need this done or that, but when it's something medically that is a big deal, it's important that you have somebody that you trust and that really seems to care. And when I came to Designer Smiles, that's really the feeling I got. Everything was explained to me, where I really had an understanding of it. A program was put together, and you could tell that they were very particular about their work and very thorough, and it's a nice place. The staff here makes you feel comfortable. Never had any pain compared to past experiences. You know, you go in to a dentist office, it's like, oh, I don't want to go to the dentist. But here, you know, even my kids, it's not a big deal. You say, we're going to the dentist today. It's like, oh, okay. So we've had great experiences here.
I guess the first time that I met Ann was through her dad, because he was our dentist prior to her graduating from dental school. And then when she graduated, she became not only a real friend to us, but she also became a mentor and a role model to our daughter, who now is going to dental school. So anyway, Ann, we had always gone to Mark basically to get our teeth cleaned, and part of my treatment plan that Mark had always told us is, you know, you really need to get your jaw moved. So I resisted and resisted, and everybody had told me that my whole life. You know, you've got this terrible underbite. You really need to get it corrected. So when Ann came on the scene, she put her foot down and said, you know, really, you absolutely need to do something about this. And she educated me, which was really great, because she actually enlightened me and told me and so much more about the implications of not being able to chew correctly, not being able to brush correctly, everything that was involved in this malocclusion that I had. So she basically, it was so easy because she just had all the connections for me. She said, I want you to go talk to this doctor, this specialist. She had it all figured out. She knew exactly, and she kept telling me, you're going to be my butterfly when you're done with this. So, I mean, believe it or not, it was probably about a 3-year process. I had to go get orthodontic treatment. And basically this is everything that I knew that I had to get done, but I'd just been procrastinating about, my whole life. And anyway, so Ann set me up with the right orthodontist. We got through the treatment. Before I knew it, I was going into getting the surgery done. There were some really rough spots, and she was always there for me. And anyway, I emerged a new person, and I have less of an underbite, and I have more of confidence, and I feel much better about myself. So thank you, Dr. Ann.